Hello and welcome to the final episode in our Mental Health Month video series. I'm Liz Farquhar and today we are talking about psychological safety at work with Dr. Deanna Paulin, the Director of People and Culture at New South Wales Health Pathology. Dee, thanks so much for joining us today.
Oh, thanks for having me.
Now, what do we mean when we talk about psychological safety at work? What is that?
Yeah, it's interesting. I think that psychological safety as a construct has become quite popular, but it's a construct that's been around for a long time. I think it was cemented and sort of popularised by the work of Amy Edmondson, so people sort of hear or might be familiar with it in terms of the work Amy's done. There's lots of definitions out there, but I think for me, put simply, it's a workspace or an environment where you feel that you can be yourself. It's an environment where you can ask questions, that you feel safe to challenge, to try new things and to make mistakes. So sort of simply, I think that's what psychological safety is.
And not feel as though you can't speak out, that you're not part of the group, I suppose.
Yeah, that's right. And I think that the reason it's grown in popularity is because it's a precursor or an enabler to so many things. If you feel that you can turn up to work, like I'm a bit of a dork and I feel like I can turn up to work and be that dork and challenge and question things without worrying that I'm going to embarrass myself or that I'll get in trouble or that people will sort of make me embarrassed.
Yeah. And so particularly looking at the health sector, what would you say are the main challenges in this sector for when it comes to psychological safety at work and what managers can do to promote it?
I think there's an obvious challenge in health, which is around workloads. When workloads are really high, it's more difficult to engage in those behaviours that set those environments for psychological safety, giving space to, generate ideas, challenging status quo, trying new things and failing. When workload's high, that's a bit harder. I also think that there's the very sort of traditional challenge, which you hear a lot about, which is around the hierarchical nature. There are absolutely scenarios and situations where, the seniority or the experience or the professional sort of nature of roles creates an environment where maybe traditionally people don't feel safe to speak up. Although I do think that that's changing in the training of those professions. But I do think if you're in a role where you might be more senior or come from a profession that has that sort of professionalisation or seniority, to think about how you might counteract some of those traditional hierarchies and create that space, because you'll need to lean in more to do more if there is those traditional sort of hierarchy and boundaries in place.
And that definitely, as you say, is something managers can look at as part of their role. They're perhaps the conduit between the more junior staff and the more senior staff and making sure the whole team feels valued.
And I reckon that's why there's some myths around psychological safety and a lot of the emphasis around who's responsible for generating it has gone to the manager. It's not that the manager's the one who is responsible for creating that space. It's everybody's responsibilities, and your environment's only as safe as the least safe person. And I think that's the challenging thing about psychological safety. But it falls on the manager because you've got to do more work when there's a embedded power imbalance or there's relationships where you have more responsibility to create space and ask people to sort of challenge status quo.
And what can be some of the downsides in the health sector when people don't feel safe to, say, admit they made a mistake or speak out if they think something can be done better?
I think that the downsides of not having psychological safety is that things sort of stay the same. We know that a psychologically safe environment, individuals or people are more likely to be able to learn and grow, and likewise the team will learn and grow. And you'll challenge and do things better and differently. So when we think about it, New South Wales Health Pathology, quite an ambitious agenda around change and improvement in the way that we work, working more effectively. Psychological safety is at the heart of that, because you can try new things and it may or may not work, but giving it a try is just as important. Or people become learn and grow just far more quickly when they're in an environment where they can make a mistake or they can ask questions. So I think the downside is that it stays the same, whereas if you've got that psychologically safe environment, people will grow, the organisation will grow and the teams will grow.
And that change process will hopefully be a lot more successful when you've got people willing to get involved and help create the change that they want to see in their workplace.
That's right. I think everyone can then get in and take a role, and that's what we want from across our organisation.
So how much would you say company culture does play a role? It's up to individuals. So that idea of company culture and putting in place strategies like our people strategy, how much will that help?
So I think that, look, a strategy is only as good as how well you implement it. We know that culture of an organisation really enables or detracts from psychological safety in teams. I personally think that psychological safety is more a team-based construct. And so here at Pathology, we've really defined belonging as our overarching sort of people strategy, that everyone feels they belong working at Pathology. But then we've really embedded that construct of psychological safety within your local teams. And you'll see that it's sort of scattered throughout the whole people strategy, but really embedded in the priority outcome one, which is our people feel safe and valued. And when we talk about safe, we don't just mean physically safe. I think we've moved a long way as an organisation around that. It is about being psychologically safe. And so the people strategy and a company culture, I suppose, set the expectations for the way that we work. It recognises that that's not everyone's experiences, but it's our commitment to where we want to prioritise. It's then about how do we bring it to life. And I think, and again, the people strategy sort of articulates it's everyone's responsibility. Everyone needs to be accountable for their own behaviour, for what they do, for how they lean into things. One of the things I don't like about psychological safety in terms of the way it's become so popular is there's a lot of myths around it. I talked about it before. But I think people misconceive psychological safety as being comfortable or not pushed or nice. And it's not about that, actually. It's about, in fact, a lot of organisations or teams that have really strong psychological safety, people working in them feel uncomfortable because you're growing, you're pushing yourself, you're taking on more.
People are asking the hard questions.
They're asking the hard questions. Yep. And so it doesn't feel comfortable. It's not about being nice. Nor is it about sort of being brutally honest. I think if you ever start a conversation with, I'm just being honest, you're probably off track in terms of psychological safety. But it's about pushing people, challenging people, holding people to account, but in a way that is about growth and improvement and the outcome rather than sort of personality or sort of behaviours.
Yeah. And what would you say are the main actions that we can take as individuals in a workplace to, I guess, support colleagues if we can see that they're maybe not feeling as though they're able to speak out or to hold our team to account?
One of the things I think is, particularly for managers and for our people, is read and listen about psychological safety. There's so much out there, so many strategies, and I could talk for days, and there's people that run courses that do talk for days about what works, but ultimately it's around what strategies will work for you. For me, it's a big thing is about truly looking and listening to people. So much gets missed, I think, in how people respond. Monitoring facial expressions, repeat patterns of behaviours, people lean in or lean back. It's being really observant to the people around you. I think it's about creating dedicated time and space to do it. Practice makes perfect, and so it might be that there's a new test coming in or there's a change of way you want to work or roster. Create that space, invite the team in and hold an open discussion. There's a whole lot of tools and frameworks out there to help support those meetings, but create that dedicated time and space. And then the third is that we are all human, we all make mistakes. In fact, that's the whole part of psychological safety. So it's okay if you have a bad day or you may not have been your best self one day, but to be able to come in the next day and say, oh, I'm really sorry. I had a bad day. This is what was going on for me. I know that would have impacted you and I'm really sorry. Or likewise, probably another strategy is asking for feedback. People find it really difficult, particularly if there's that power imbalance, to give that feedback. So ask for it. And then, of course, respond with gratitude.
Be prepared to listen to what's coming. Yeah.
So they're just some, but I think there's so many cool podcasts, papers, books out there. It's about finding. It's a bit like a buffet of resources. You go and you sort of have a look around at all the resources and then choose the food or choose the tools that work for you. And there's so many resources, and we can make them available after today that people can go to have a look at.
Okay, well, Dee, thank you so much for joining us today. It's been a pleasure talking to you.